me tell you a little bit about essential oils first, because they're amazing. If they're pure and medicinal grade, they are antimicrobial, antibacterial, antifungal, antivirus, okay? And essential oils, here's an example. Well, we'll get into this later. Eucalyptus, all of you have heard of eucalyptus, right? Okay. Jean Valnet, MD, says a solution of 2% eucalyptus oil sprayed in the air will kill 70% of airborne staph bacteria. What are you guys dealing with in the hospital? Right? Lemon oil. Anti-infectious, disinfectant, antibacterial, antiseptic, antiviral, vitamin P-like action for improving circulation, promotes white blood cell formation, and improves immune function. Okay? And there's no allergies to pure essential oils when they are pure and medicinal. And the company I use, I have brochures here, and these are the 6 to 7 products I'm passing around. So there are rules. You do not get it in your eyes. If you do, you need to wash them out with straight oil. No, oil. Water can drive it in deeper. You just use straight oil and flush it out. All right, so the other wonderful thing about essential oils, besides all those I just listed, is they're the highest frequencies of any substance known to man. Okay? Pure rose oil, which has been brought to you by great expense in the boxes there. Okay? It takes 50,000 roses to make 1 ounce of pure rose oil. Okay? Yeah, she said, Ann says, no stealing. Okay. What I do is I put, and it's in a spray, I put the pure oil, 1 drop on someone's forehead when they're depressed, sad, anxious, on their heart region. Almost, now I am Irish, so I slightly exaggerate, but almost every time, this is what I get. Oh, that's great. I mean, in 5 seconds, their whole energy frequency changes. Okay? Alrighty. Oils start at 52 hertz, and they go up as high as 320 hertz, and 320 hertz is pure rose oil. Okay? It's like liquid gold. Aromatherapy, I don't want to spend time getting into the history. You can find that in your notes. But it's been used in Europe, Russia, and Germany by all the medical doctors in their regular practices. It removes metallic particles and toxins from the air. And I also brought this because I think it would be really useful for all of you to have this, at least in the nurse's waiting room. This is an atomizer. And this is a commercial grade. And you can put it on a timer where it goes on 5 minutes every half hour. I have Immune Shield in it right now, which is one of my favorites, that kills germs in the air. So when I'm working on sick clients, I put this on in between the clients really quick, kills all the germs in the air, and we're good to go. You can also use Serene and Serenity, which is in there. That is for relaxing and calming nerves. My favorite is Rapid Relief. Because I'll be massaging. I've done deep tissue work for 30 years, and I'll be massaging. I'll go, ooh, pinched nerve. I don't even have to stop massaging. I spray that on, I rub it in really quick, I keep going, and typically in 20 minutes the pain's gone. Reduces inflammation, swelling, increases circulation. So the cotton swabs in there are so you don't have to get your hands too gooey if you don't want. So there is just huge effects of essential oil, and it's something really simple that you can have personally as nurses. I know Ann already uses them. And you can incorporate that into the hospital really easily, especially with the diffusers there. Okay, so, yes?
I just want to make a note. We use some of the essential oils down in radiology in our IR suite. And but I always make a point of asking the patient, are you allergic to anything? Do you want to have this? Some patients, you get those patients, oh, I'm allergic to every perfume, I'm allergic to every scent, keep it away from me. You don't want to use it on those patients because they're not going to respond in a way that's going to be helpful for them. But we use Immune Shield, we put it on patients' feet, on the soles of their feet, and we use Immune Air, especially if any of us are sick. We can spray it in the air, or if someone, we get those patients who don't smell so good. So we use that in the air. I mean, I know in ED we've used peppermint oil in the past. And the other thing that we started doing, I guess this was maybe about a year ago, we prep people a lot. And they come upstairs and they've got these big, huge preps. But what we try to do is take off some of that prep solution that's around the dressing. So we use the essential oil-based Castile soaps, eucalyptus, peppermint, I think we have almond, citrus, and lemon, and there's one other one I'm forgetting. But it's really nice for getting the soap off the patients. Lavender. And it smells good. And we say to the patient, what flavor would you like to have? Or which scent would you like to have? Okay, go ahead.
It has direct ties straight to the limbic system, and it triggers emotions, usually good emotions. And lavender was the first essential oil ever discovered to be used for medicinal effects. It happened when this alchemist in his lab got second-degree burns in his hand. He happened to have crushed oil. He put that in. Pain started going in about 10 minutes. I believe you use that in hospitals, don't you, lavender on burns? Oh, it does tend to be a little high in estrogens. Lavender does. It's imperative. These that are passed around are 100% wildcrafted, 100% organic, 100% medicinal volume. You have to have enough sequesterines and chemical constituents. This is the immune system of plants. This is what they use to fight disease. So you have to have that quality. You don't want any fillers or anything.